Ever wonder why taking one shot of testosterone is not a good way to do this? Listen up. What up, TikTok? My name is Vivian. I'm a nurse practitioner that treats testosterone deficiencies in men and a ton of erectile dysfunction. If you like my content here on TikTok and you'd like to be my patient, you can click the link in my bio. You can send me a direct message. You can go right to the website, elevatewellnessgroup.com. If you have a telephone and live in the United States, you can be my patient, and we take transfers too. All right, so my director, Gil, is going to explain to you why one shot a week, no matter what the amount is, typically the doctors prescribe 200 milligrams once a week, which is wrong, why that doesn't work. Listen up.
Why is one injection a week or once every 2 weeks the wrong way to do testosterone therapy? So if you understand pharmacology, there's two aspects, pharmacokinetics and pharmacodynamics. The difference between the two is pharmacokinetics is what your body does to a drug, and pharmacodynamics is what the drug does to your body. Pharmacokinetics has four aspects to it. The first one is absorption, followed by circulation, followed by metabolism, and then lastly, excretion. The amount of time it takes this process of these four layers to take effect is what we call the half-life of the drug. Testosterone cypionate, which is the most commonly used form of injectable testosterone in America, has a half-life of approximately 7 days, and that is generally determined by the metabolism of the individual patient. But we'll get a little more into that later. Let's assess real quick what happens when you take one injection per week or every other week. So when you get a 200 milligram injection, 7 days later, you have 50% left. That is the pharmacokinetic half-life. By day 14, you're down to another 50%. So 50% of 200 is 100, another 50% elapsed, brings us down to 50. You then get another injection of 200 and you peak, and then the process repeats itself. As you can imagine, if you feel great somewhere along this curve, this is a terrible place to be. You're either on the decline or on the rise. This is why guys that receive one injection every other week always crash and burn before their next injection. On the flip side, if you were to get an injection and then midweek get re-upped and then hit the 7-day mark and get re-upped, this is a much more stable level on average than the big seesaw effect we saw previously. Seems fairly simple, right? Just split my dose twice a week and I'm good to go. I wish it was that simple. Here's the problem. Remember when I said testosterone cypionate has a half-life of 7 days approximately? What's the varying factor? Something called sex hormone binding globulin. So sex hormone binding globulin, also known as SHBG, is a protein in your blood that's made by the liver and binds tightly to sex hormones, including testosterone. This hormone is the key factor for the frequency and how your provider should be guiding your treatment. The problem lies here. All androgens lower SHBG significantly. By how much, you ask? The answer is dose dependent. A large bolus of 200 milligram injection has an absolute crushing effect on SHBG. As SHBG goes down, the half-life of the medication is diminished. The problem is that metabolic factors like insulin resistance, diabetes, obesity, all play a tremendous role in lowering SHBG. Now, we're adding testosterone on top of that, and SHBG starts to drop very fast. As SHBG is reduced, the metabolism and excretion of the hormone is increased in rate. This all requires proper adjustments to frequency and proper dosing, not only in intervals, but in terms of milligrams, to ensure that we don't overcrush SHBG and make you feel terrible. Lastly, a healthy male produces approximately 10 milligrams of testosterone per night in their sleep, which totals about 70 milligrams per week. 200 milligrams per week is triple the healthy range of a male, and more isn't always better, especially when it comes to hormones. Remember, on what presumably should be a lifelong treatment when done correctly, has longevity. We don't have to rush to get there. We have to make sure that we remain in the game as long as possible, reaping the benefits and staving off all the side effects.
Did you catch all that? Did we lose you somewhere? Well, this is why you need a provider who understands how to do this and who knows how to dose you correctly based on SHBG, based on age and other metabolic factors, so that you can eventually feel better and hopefully get better long term. I hope all that made sense. I hope you learned something today. Again, if you'd like to be my patient, you can click the link in my bio. You can go directly to the website, elevatewellnessgroup.com, or you can send me a DM here on TikTok. If you have a telephone and live in the United States, you can be my patient, and we take transfers too.